Welcome everyone to our H5 bird flu webinar for the dairy industry. My name is Andy Hancock and I'm the Sustainable Animal Care Manager at Dairy Australia. I'd like to start by acknowledging the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to their elders, past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people online with us today. Thanks very much for joining. We've had roughly 400 people register for today, which is fantastic, and it just really highlights that this is an important issue for the Australian dairy industry. Obviously, it's important to other sectors as well, and the Australian bird and wildlife population. But given what has happened in the US historically, there's also a strong interest from dairy. So thanks for taking the time to dial in. About 1 year ago, Dairy Australia, the Department of Agriculture, Fisheries and Forestry, and Australian dairy farmers co-hosted a webinar to discuss the emergence of the H5N1 strain in dairy herds in the US. This was still a relatively recent development at the time, and our understanding of the disease and how it presented and spread in dairy cattle was still fairly limited. When COVID-19 first emerged, governments also had to make decisions based on the limited information that was available about the disease. And as more was known, governments were able to implement more targeted and effective control strategies. So similarly, for H5 bird flu in dairy cattle, we now have a lot more information available from the US outbreak to better understand the risk of a similar spillover event occurring in Australia. That is, if H5N1 avian influenza was to reach our shores via, wildlife or other methods of entry. So understanding these risks and the factors that may drive the spread of disease into, within and between Australian dairy herds will help guide government and industry in the development of effective preparedness and response strategies. With this objective in mind, in early 2025, the Department of Agriculture, Fisheries and Forestry, with support from Dairy Australia, commissioned Ausvet to undertake an independent risk assessment for H5 bird flu in Australian dairy cattle. Today, we'll discuss its key findings and what they mean for the industry. And please note that we will distribute the link to the final report for those that haven't had the chance to review it after this webinar. Now, just for some housekeeping, please note, as expected, that this webinar is going to be recorded and circulated via email so that those that couldn't make it in real time can join and log in later. Or like me, they can put in the Outlook folder, which is a graveyard of unwatched webinars, to watch at a future date. And we will also make this available on the Dairy Australia EAD webpage after the webinar. There's a Q&A button at the bottom of your screens, and I encourage you to submit questions at any time throughout the webinar. And your questions will go through to Sally Taylor, the Stakeholder Engagement and Issues Manager at Dairy Australia, who will facilitate a Q&A following the presentations. Whilst it's unlikely we'll be able to answer all of the questions that are submitted during the webinar, we'll be documenting them all and we'll look to address as many as possible through an FAQ document and other resources which we'll share with participants. Lastly, I just would like to clarify terminology. So I'm sure you've heard many terms: H5N1, HPAI, H5, HPAI, clade 2344B. Just for consistency of understanding and terminology, we're going to use the term H5 bird flu throughout this webinar, but those terms are used interchangeably, but we're going to use H5 bird flu. So I'd now like to introduce Dr. Brant Smith, the National Animal Disease Preparedness Coordinator and First Assistant Secretary for Animal Biosecurity at DAF. Dr. Smith will be providing an overview and update on H5 bird flu preparedness activities underway with the Australian Government. Thanks very much, Brant. Over to you.
Great, thanks. Thanks, Andy. And thanks very much for putting on this webinar today. It's a fantastic opportunity for us to talk about what's a really important issue. For those that don't know me, I'm a vet by trade and did a lot of dairy work, so it's sort of near and dear to my heart in northeast Victoria, south coast of New South Wales, and Camden and Central West. So this is a passion of mine, and I certainly do miss my dairy vet days. Just not the carvings in the snow. I don't miss them at all. But look, so I just thought over the next few slides, we're going to provide a global update on the H5 bird flu situation and an overview of what the Australian government is doing to prepare for this threat. So as you will have seen around the world, we've seen rising cases of serious outbreaks of H5 bird flu, and in particular the clade that Andy mentioned before, 2344B. So it's been spreading rapidly and affecting a wider range of species than what we've seen previously in other strains of bird flu. And it has caused major losses of poultry, in particular worldwide. But what's most recent it's affected more than 560 species of birds and over 100 species of mammals. So that's certainly something that's really changed in most recent times. So, I mean, we all understand that an incursion in Australia would have major consequences for our wildlife and poultry sectors, but we have seen this virus detected in dairy cattle for the first time in the United States in early 2024, and it does continue to cause illness and production losses, and it is quite a unique event. So now, whilst the mortality rates have been quite low, there's been fairly high levels of morbidity or clinical signs, and there's certainly useful things for us that we can learn from the US counterparts in how they've responded to these outbreaks. Next slide, please. So as you can see, the global situation is continuing to evolve, and in this slide you can really see, I guess, the potential pathways and entry points from us. So it is well known we're the only continent that doesn't have H5 bird flu, and it continues to pose an ongoing risk to us. As many of you would know, the most likely entry point is through migratory birds, wild birds that come from the north and the south through some of these flyways that you can see here on an annual basis, and they come in quite large numbers. There isn't any obvious way to prevent. I mean, we can't prevent migratory birds entering into Australia, nor preventing the transmission between wild birds. And then, of course, there's the entry not just from those northern flyways, but from the Antarctic regions fire-infected birds. One interesting point, though, is given that we have had that case, is why haven't we seen it yet? I think there's probably a few factors. I think there's a distance factor. A lot of the birds get sick en route and don't tend to make it those long distances. So there's probably some ecological factors that are causing that. It doesn't mean that will remain the case, but certainly that's been something that we've noted, but something we continue to keep a close eye on. Oh, you've already moved to the next slide. Well done. I didn't even need to prompt. Great stuff. So, I mean, I guess the good news about all of this is that we've certainly put a really strong government, attention towards this. And particularly in recent times, we established a dedicated task force, the HPAI Preparedness Task Force, that sits in my division, to really lead, coordinate, and strengthen our national preparedness activities for the potential arrival of H5 bird flu. So this is a whole of government task force, but primarily agriculture, environment, health, and emergency management agencies. And we work very closely across state and territory governments and industry to really sort of coordinate our approach to planning and preparation. And on that, we were successful in getting $100 million of investment to strengthen the surveillance, preparedness, and response capability. 37 of that is for agriculture and environment, and environmental biosecurity comes under, environment. And then the more the threatened species work is the 35.9 million. And then the remainder goes to some of those pandemic preparedness, influenza vaccines that the Department of Health has for human health protection. Next slide, please. Get myself out of order. Yeah. So, I mean, what we have seen over the last probably 18 months is a really significant uplift in our preparedness, and we've really tried to drive this sort of One Health collaborative approach between the Commonwealth partners and particularly with industry. And we have made a lot of progress around our national readiness for potential incursions. And some of the things we've done, it sounds boring, but it's important, is is really looking at our national governance arrangements. So we've agreed between ministers to rapidly manage the impacts of infected wildlife through what we've called a national management agreement. We've had agreements in place for when it impacts industry directly, and you'd be familiar with those, with IADRAs and the like, but we didn't have a mechanism in place if it just impacted wildlife without impacting industry. So we've used the same approach and models that we've got in place that work well through national management group and the like. But this is something that's now come into effect, and we can mobilise quickly to draw together not just the ag side, which we then tend to do quite quickly, but the environment and health all together in one form. We've also done a lot of work around surveillance across the nation, and we've enhanced funding to Wildlife Health Australia. They do the National Avian Influenza Wild Bird Survey, and that's been really important to look at where there are congregations of wild birds to see what sort of signs of disease we would find. And pleasingly, we haven't found any signs of or detected any cases of this virus. The other thing that's been really important is new equipment. So we tried to make the funding package practical and front-loaded. So we made it a 2-year package to really get things on the ground. So we weren't just talking about sort of motherhood statements of collaboration. We really wanted to work on what are the things that would really matter, particularly the states and territories. So around sort of, mobile labs, biosecurity trailers, mobile command units, the things that will matter when and as something occurs. And that's something we've been working really closely with the states and territories to put in place. Testing capacity has been really important, and we're looking at reducing the times to confirm disease results with new lab equipment and improvements to diagnostic tests, and including validating point of care tests for animals in remote settings. That's been a really important focus for ours. Those of us remember the point of care COVID testing up the nose. It's kind of similar. It just gives us, it's a screening tool to sort of enable us to better enable earlier diagnostics rather than having to rely back through the ACDP labs as confirmatory testing, which is still important. The other thing is jurisdictions to really are training for surge workforces so they can be required for on-ground action and incident control. Comms is really important, communications, and certainly we've found, particularly with the H7 outbreak and those that remember through COVID, getting those clear and consistent messages is absolutely critical. So we do have a good piece of dedicated funding for that, and we've been doing some behavioural research and commissioned by the HPAI Taskforce to see the sorts of things people want to know and why. Clearly, there is a divergence of views. There's I wouldn't say the crazy cookers, but there's quite a lot of conspiracy theory stuff on one end, right through to just genuinely people wanting to be informed about what does this mean for my birds, my animals, myself, and we need to try to accommodate all of those. And I guess the other thing we've done, which is really important, is simulation exercises. So we've held some of those last year and this year, notably exercise Volare, exercise Convergence, and exercise Flight Path. And that's really designed to look at ways that we can engage with stakeholders, industry, to strengthen our national response arrangements and planning. And you can test the system, stress test the system. And that's been really important. And then previously we did exercise Waterhole, which we stress tested a lumpy skin disease outbreak in the north, avian influenza outbreak in the south, and just see how the labs coped around the diagnostics, the way they work together. And that was a really successful outcome. So what does this do? It helps sort of fast track our ability to effectively detect and respond to outbreaks, as well as trying to mitigate potential impacts. But it's important that we continue to build on what we've got as far as this readiness, and to learn from countries like the US, UK, and others who have already got a lot of experience in this space. Next slide. So I guess where does that leave us now? I mean, one of the things that's really important is that we would partner, and we've done so with Dairy Australia in the past on other things. So it was great to do so, and commissioning Ausvet, who again we've worked with over many years to really comprehensively assess the risks of H5 bird flu in Australian dairy cattle. And the rapid risk assessments were also conducted for Australia's other key livestock industries: beef, cattle, pigs, sheep, and goats. And the report also includes response guidance for industry and governments to consider. The key sort of message for me is the more we can do in peacetime, the better we will be for if and when the metaphorical gun fires, because that's just going to be a challenge. The more you can do to prepare, plan, look at what's required around, on-farm biosecurity measures, which are really important anyway. I remember having to do that between dairies. That sort of stuff is critical for endemic disease management, let alone exotic diseases. So the overall risk for the work we was undertaken is that it's low, and that's a good thing. But as Brendan will go through, who's incredibly bright, and you can ask all the hard questions to him, is that there's still a lot of uncertainty around that, but it is a really useful guide around what it might look like. And so really what we want to work through is the findings of that report, how we can continue to work together, because I know you hear the old biosecurity is a shared responsibility, but it absolutely is. We can't do it all by ourselves. You guys can't do it all by yourselves. We always have to work together, and that's when it works best. So again, just a big thanks to the folks that are involved, Dairy Australia, Ausvet, and my crew as well. We've got the reports and the fact sheets with frequently asked questions on our DAF website for reference. So you need it. I promise I'll be quick. I might just fly through this last sort of slide. I guess the key thing is that we've provided a lot of work around preparedness, and there's a lot of work being done, not just at the high level, but sort of practical things like the response strategy for the management of livestock in the event of a detection in a herd. So this is being done through an interjurisdictional working group under the Animal Health Committee, which is Australia's kind of national body for animal health, leadership body. And this is really complementing what we've already got. We've got some good nationally agreed plans, including Ausvet plan for avian influenza strategies. But really what we want to do is saying, okay, what does this look like in the settings around, livestock, including surveillance, treatment, movement restrictions, testing, and other control options. So the next stages will be around engaging with industry as well in the new year, in 2026. So we'll make sure you look out for that as well. And I think also just make sure people know that we do have a very strong national diagnostic capability. We do have excellent laboratories and the like, but it's going to need to have a really integrated, holistic approach across not just the ACDP, but regional laboratories and the like. We have seen that it can be detected in livestock through this, outbreaks in the US and in milk as well. So that's why we're really trying to make it. Well, what does that look like for us, and how can we make sure we get ahead of the curve on all that work? And I think one more slide. There we go. Okay, so I guess the other thing too that also comes up, and as a vet, I won't try and stray too far in the human health, even though we do tend to diagnose ourselves quite regularly on our own illnesses, which I don't recommend. But it does touch on, some of the public health impacts, and the interim Australian Centre for Disease Control at the Department of Health has assessed the risk of H5 HPAI in the Australian public to be low for people. And in the US, whilst there has been sort of sporadic cases in dairy workers, it does highlight the importance of that public health guidance to protect against H5 bird flu, because in the communications behavioural work that we looked at, that's one of the key questions. What does this mean for me? Understandably, my kids and my dog. But it is interesting what people's mindsets are. But there's some really good information on our health website, Department of Health website. So that would be the best place to go to get any advice. They've also got some really good fact sheets as well. So on that note, I'll hand back to my good friend Andy, and I'll let you get on with the next stage of the process. But thanks very much for the opportunity to chat today.
Thanks very much, Brant. And I'd just like to echo the thanks you put out there before to the team that put together this project. We wouldn't be here without significant investment from DAF, with co-investment from DA, and also the good work of Ausvet. So, yeah, I'd like to just thank you for that collaboration, and now pass over to Brendan Cowlard. So, Dr. Brendan Cowlard is the Executive Director at Ausvet, who will present the key findings of the independent risk assessment. And again, we would encourage you guys to submit any questions that you have via the Q&A function at the bottom of your screen. So thanks, Brendan. Over to you.
Oh, thanks, Andy, and thanks, Brand, also. So, in my part of this webinar, I'm going to present the findings of this risk assessment, looking at the potential risks of H5 bird flu to the Australian dairy industry. So it's a summary of those results. So there's a lot more detail in the report. But before I do that, just thanks to Robin Hall for completing much of this work at Ausvet. She's done a great job and done half this work herself, and she's a great scientist. So thanks very much, Robin. Right, so I guess I wanted to start with saying why and how has bird flu spread through the US dairy industry? So I guess in 2024, H5 bird flu was detected for the first time in dairy cattle in the United States, and it spread across 18 states and affected around 1,000 dairy herds. It's got to 1,083 now. What you see when you see this infection is you get a big drop in milk production. You get thick, inconsistent milk, like with mastitis milk, and you get fever and lethargy. It generally looks like a very bad mastitis with a sick cow. It spreads between herds mainly due to the movement of milking cows, but it can also be due to the movement of milking equipment and infected milk. I guess the situation in the US is pretty unprecedented and pretty unique because to date there's been no detections of H5 bird flu in dairy cattle in other countries. And this is despite sort of widespread circulation of the virus globally, except for Australia and the Pacific. It's happened for several years. It's been spreading across lots of dairy industries, and we haven't seen an outbreak in other dairy industries. And it's not likely it's been missed. There are active surveillance programs going for H5 bird flu in dairy industries in other countries, and no detection. So a good example of that is Canada. They're really concerned about bird flu in their dairy industry because they're right next to the US. So they've been looking hard, but they still haven't found it. So people are looking for it, and it hasn't been detected in other dairy industries. So that keeps things in perspective. So I guess investigations to date suggest there's a single spillover event that started this whole thing, and that was B313. It's a type of H5 bird flu, and that virus was a spillover is where a virus spreads from a mammal, from one species to another, and that happened in late 23, 24, and this is where it was introduced into that US dairy herd. This was followed by two other spillovers that they detected, and that was a different subtype of H5 bird flu, D11, and that was in early 2025, and they found that through National Milk Testing Strategy in the US. They don't really know what caused these spillover events, but there's a few possible sources of infections that have been looked at, and that's from wild birds or from nearby poultry farms. But the spread of infection between cattle and dairy herds is linked to that virus affinity for mammary tissue. It really just loves to live in the udder of dairy cattle, and that's why you find very high concentrations of this virus in milk. So milk is the primary source of infection. But it's not just limited to dairy cows. It's been, as Brant said earlier, there's been lots of other mammal and bird species affected. But in livestock species, they have found the virus sporadically in alpacas, pigs, goats in the US, and also for the first time in UK, sheep in February 25. But these haven't led to sustained spread, and they haven't led to big epidemics in sick animals. So it's really just dairy cattle as a livestock species that have been affected so far. It's also affected a few cats. So these are cats that are on dairies. When this gets into a dairy herd, it seems to kill all the cats in a dairy. So it's very lethal for cats. It's a sad but interesting sideline there. So I guess I just want to talk now about the impacts on the US dairy production. So the primary economic impacts of H5 bird flu in the US dairy industry has been through reduced milk production and early removing or culling of animals from the milking herd. So they've done a few studies recently in the US, so Baker and Caserta and others, and these figures come from those recent studies in 2025. So the mortality rates in dairy cattle are low, so they're less than 2%. So if you've got 100 cows infected on your dairy farm, only a couple of them will die. So it's pretty low mortality rate. But what they tend to do is get very sick and they lose their milk production, and they're sick for 1 to 3 weeks. But that milk production drop might last for much longer, might last for a few months, for example, and that's leading to a bit of culling. So the response has been, it started slowly, but it's going pretty well now. they're trying to eliminate the virus from herds and contain the spread of infection so it doesn't get any worse, really. That's their basic strategy. They've been doing a national milk testing strategy, and that's where any milking cows move between states, they test them first, and that's just to keep the free states free and contain that infection. They've been doing bulk milk testing for early detection of infected herds, and that's at the processor level. So they're detecting infected herds much more early and quicker now. And they're also doing giving a lot of support for on-farm biosecurity, so they're enhancing on-farm biosecurity and helping farmers do that. So these measures are having impacts, because when we started this project back in February, there was around 1,000 farms, and that built up over a year. But since we've been doing this project, it's only gone to 1,083 farms. So that they're getting on top of it slowly. So these things are working, which gives us hope if we ever had one here. So I guess just to talk about what we actually did for our bit of a risk assessment. We followed international guidelines. So the World Organization for Animal Health has a good detailed methodology for doing risk analyses, and that's what we followed. It gives us a comprehensive and a structured approach to these sorts of things. We did make an assumption, though. It's a hypothetical assumption. We assumed that disease was present in Australia in wild birds when we did this assessment, and then we looked at whether or not the disease could spread to the dairy industry and start spreading the dairy industry from there. So it is a hypothetical assessment. We don't have disease yet, but it was necessary for us to assume that for preparedness reasons. So we estimated the risk of a H5 bird flu virus or a similar strain to that in the US. Would it enter an Australian dairy herd and spread through that national herd? So that, to do this, we looked at a couple of things. When you look at risk, you look at the likelihood of something happening, and you also look at the consequences of that happening. So we looked at both those things. And to get our information for this study, we looked at scientific literature, which was predominantly from the US outbreak, although not all that's published yet. And we looked at some farm level spread modeling, which we wrote a model to do that. And then we looked at, to make this relevant to Australia and not just transplant a US study into Australia, we did a limited number, 25 farm assessments. And we looked at their biosecurity in relation to how that would keep out H5 bird flu. And so we made it a bit more Australianised rather than just using US data. So that's what we did. In terms of the pathways, so we looked at what's the likelihood of this occurring. So to do that, we looked at the different pathways of the way this virus interacts with dairy farms. And so we said, look, how would it enter into dairy cattle? Would it be via wild birds, poultry, like poultry litter, or mammals, or people that have got virus on them, or their equipment? And then once it's on a farm, how would it spread in that farm? Would it spread via aerosol or direct contact with cattle? Would it be contaminated milking equipment, or are you feeding raw milk to calves? And then once it's on a farm going, how would it spread between farms? Would that be with cattle movements, or movements of raw milk, or movements of equipment that's contaminated? So that all gave us the pathways where it could spread and the likelihood of that spreading. So we then looked at the second part of the risk, which is consequences. So what are the impacts? How would it cause impacts? So as I said before, risk is sort of a combination of impacts and likelihood. And so those pathways and their likelihood mixed up with these impacts is how we assess risk. So the consequence assessments included all these areas that are listed here. So for example, animal health and welfare, or production and trade. So what are the impacts going to be if H5N1 starts spreading the herd to those particular features? As mentioned earlier, we didn't concentrate heavily on public health in this study. We leave that to the CDC and animal health, human health authorities. And we also note that this assessment, it wasn't a formal economic assessment. That takes a couple of years, so we wanted to be pretty quick about this assessment. It's not a trade impact assessment, but rather it's a way of recognising that there are many different possible impacts of this virus establishing dairy cattle. So I guess I'll talk about the results now. We did estimate the risk to the Australian dairy industry to be low, assuming it had established in wild birds in Australia. In terms of the other species, we did rapid risk appraisals for those, and we found it to be a negligible risk for beef and small ruminants being goats and sheep, and a low risk for pigs. But I guess in stating this, it's really important to put a caveat around this. This is early in the outbreak of the outbreak in the US, and it takes several years to get all the scientific literature through and for research to be done. So um, this is, I guess, take this with a grain of salt. There's high uncertainty in these estimates, but it's the best estimate we've got this time. So, for example, there's limited understanding of virus behaviour in Australia and the long-term impacts of H5 bird flu infection in mammals. So I guess the summary there is that these are the best estimates at this point in time. You've got to start somewhere, but further research will refine these estimates over time. So I guess the elephant in the room here is that the US has an outbreak. So clearly they've had 3 spillover events, so their risk is high. But we've assessed the dairy cattle risk in Australia as being quite low. So why is that? I guess I'll just address that now. I guess what we're thinking, and what Dairy Australia and DAF are thinking is that the Australian and US dairy industries are quite different in size. They're very different in size, distribution, and types of production. So, for example, the US industry is dominated by large-scale, interconnected, intensive dairy operations where they move cattle between dairies all the time, and this may have helped allow the virus to establish and spread between herds. In contrast, Australia's dairy industry is much smaller, with mainly a pasture-based production. It's got lower farm densities, fewer connections between farms, and these may act as barriers to disease transmission and the thing establishing. Because when we looked at the pathways, they just weren't the same as what was happening in the US. So I guess my final slide, we did do some recommendations from our report. For producers, it really revolves around biosecurity for you guys. That's the cornerstone of preparing for a potential H5 bird flu outbreak. So have your biosecurity plan written, update it, make sure it's relevant, and operate and live that biosecurity plan. That's one of the best things you can do to prepare, because it was spread of cow to cow mostly in the US that led this to happen. So if you're careful with your biosecurity of animal impact, animal introductions, that'll be one way of managing this. We think the other thing to do is just to be aware and do really good surveillance. So what does that mean? It means you guys see disease when it occurs on a farm. And so if you keep your eyes open for really unusual clinical signs in dairy cattle, like mastitis that seems to be spreading rapidly and severe, mass mortalities in birds or any other animal species, deaths in your cattle, keep your eye out for that. And if you do see it, report it to your private veterinarian or to that disease watch hotline that Australia's got. It's an emergency animal disease hotline, 1-800-675-888. That's 1-800-675-888. You can get that from all the state DPIs and the Commonwealth. So if you act as the first eyes for this and do good surveillance and report it as soon as you see it, there's a greater chance of having a small outbreak that can be contained really well if it does occur. So that's the sort of recommendations for producers. In terms of decision makers, and here we're talking about governments and dairy industry at the national and state levels, we had a few recommendations for you guys, but to summarise those, well, first of all, to note that a lot of these are going on right now. There's lots of preparedness and response planning already underway. So, but when we wrote this a few months ago, we thought that developing nationally agreed response strategies for H5 bird flu in dairy cattle was important. So that includes diagnostic testing in milk and surveillance for early detection. So get a national agreed response strategy so we're all on one page when it happens. Developing quarantine protocols and safe movement of livestock protocols for during a response. So how do we contain that outbreak if it does occur, but still let industry function and move livestock, because you do need to move livestock, of course, even during an outbreak. And then ensuring that sort of multi-sectorial coordination engagement. This disease doesn't respect sectors, it doesn't respect boundaries, it doesn't respect borders. So how do you keep that communication going across all the sectors? And then also have specific sort of industry communications for the dairy industry, because you guys are unique compared to other sectors in many ways. So how do we actually get that communication right? Also, there's some key research gaps that need addressing. That includes sort of research into virus behaviour, both in the US and here. It took gaps such as milk treatment and disposal options. So you're going to have huge volumes of milk. If you're an infected farm, what do you do with that milk? Pasteurisation is not practical for most farms, although pasteurisation kills the virus. But how are you going to deal with that large volume of milk? and then improved diagnostics for H5 bird flu in mammals. So we can diagnose it pretty well in birds, not all bird species, but most. And well, it'll diagnose all bird species, but we've still got to do research to validate that. But how do we actually research that in mammals? So that's pretty much my presentation. Thanks for your attention. And Andy, I'll hand back to you now. Yeah.
Great. Thank you very much, Brendan. And I can see that there's some questions coming through off the back of that. So yeah, keep them coming and thanks for your engagement. And would like to, just appreciate the work that Ausvet put into this, especially Robin, Robin Hall as well. We started this project in January of this year, and you had done most of the work sort of within a sort of 6-month period, which it is, if you'll read the report, a substantial body of work. So thank you, Brendan and team. So next we've got Dr. Zoe Vogels, who's the National Milk Quality and Biosecurity Lead, at Dairy Australia. It's a good segue from the recommendations that Ausvet had around what to do on farm with respect to biosecurity. Zoe's going to dive a bit deeper into that. Like, what does that mean for you as farmers if we were to have an outbreak in Australia? So she's going to discuss how industry can plan and prepare for potential incursion and provide practical biosecurity advice for farmers. So over to you, Zoe.
Thanks, Andy. So I guess if you look at how cows infected with H5 bird flu, how they respond to the disease, the milk from a clinical cow has the most virus by far. So, for example, they will shed some in their snot and their breath a little bit. There will be some in their urine, but by far the highest levels of the virus are in that udder and in that milk. And so I guess we should assume that the milk, whether that's splashes or direct contact or aerosols of milk, they pose the greatest risk of spread between cows. Where I guess in terms of this disease, it's new. So a lot of what we learn are from experimental studies where they actually infect overseas, where they're infecting, calves and heifers and cows and seeing what happens. And it's different depending on how they've been infected. So when they've infected them by either making them breathe in the virus or, drink some milk infected with the virus, in cows that leads, or it's usually calves and heifers, they might get a nasal discharge, a cough, a bit of a lethargy, maybe a little bit of a fever, or there might even be no symptoms. So that's one type of presentation. But when they infect these cows through the teat canal, so intramammary infection, that's when they see those clinical signs that have been really reported over in America. So that's a drop in rumination, it's a drop in milk production, it's I'll go back a bit, sorry. It's that mastitis, dehydration, fever. And one thing about it is that the amount that they get infected with is proportional to the severity of the signs. So you could infect them with 100 virus particles or 1 million virus particles. They'll all show clinical mastitis, but those ones that have only been infected with 100 particles, they'll be sick. They might just not eat much. They might be lethargic and have that mastitis. But the ones that get infected with 1 million, experimentally, 80% of those cows actually were euthanized because they got so sick. So my take home from these experiments is if those cows are going to get infected, you want them to have the smallest possible infectious dose when they first get it. And so I guess one of the things is, again, we're kind of working on results from the US. There was one case study that had some good data, and they looked at the impacts of the disease in one specific herd. And so those cows that had the clinical mastitis signs for this particular herd, 40% were not in the herd a month later. And that was, some of those cows had died and the rest were culled because they just weren't making enough milk because the virus damages those milk producing cells in the udder. And I guess I kind of put this, like, what does it actually look like for you guys or, for someone? So if you, for example, had a 700 cow farm and 20% of the herd had which is kind of one of the highest, kind of a standard thing that's been reported from the US. If 20% of that herd was clinical, in a month's time, there'd be 56 less cows in your herd. So it can have a significant impact, like Brendan said earlier, on your milk production, but also on just your cow numbers and your culling rates and mortality rates. And so I guess my take home from all of these, the experimental studies, is that avoiding getting the virus into the udder, or at least minimising how much virus gets in there, is the thing that should have the greatest impact on cow health and survival in the advent of an outbreak. So on to the next slide. So I guess one of the things I used to say, out on farm dealing with calf cows actually, is that you never know when you're at the start of an outbreak. You never know when it's going to be, you don't know whether tomorrow there's going to be bird flu on your shores or whatever. And so it's really important to kind of be prepared so that if an outbreak happens, you've already got things in place to reduce your risk. And certainly from the US, the best way is to not import diseases is to have a closed herd. So rear all your own replacements. But obviously there's dairy businesses that need to purchase cattle, and we have lots of businesses within Australia where they have multiple farms and there's movement of cows between properties. And so it's really important to think about how you manage those animal movements and how do you manage the cows that you purchase. One of the interesting things from the modelling that Ausvet did was, they basically looked for anything that would reduce the risk of an outbreak. And there were two things. One of them was quarantining new animals before they joined the milking herd. And that was for 7 days reduced the risk a bit, and 14 days reduced it even more. And I guess specifically you want to separate the potentially infected udders of a new cow, or so you want to separate the potentially infected udders from the udders that aren't infected. And so, for example, you're milking your introduced cows in a separate herd at the end of milking, so that their milk isn't on the teat liners that your cows are going to be, using as well. And similarly, obviously these aren't cows that you've brought in, but just in the very unfortunate situation where you're the first farm with bird flu. If you're milking mastitis cows in a separate herd at the end of milking, again, that mastitis milk is not on the teat cup liners that other cows are going to be using. This virus there's lots of virus in the milk. So, even if you think you've done a really good job of cleaning those teat cups before they go on another cow, the chances that there'll still be virus there. So if you have a separate sick herd for your mastitis cows, that's a good thing. The other thing that the modelling suggested was that if you detected cows before they actually became clinical with that mastitis and the shedding in the milk, it could reduce the impact of an outbreak. I don't think it eliminated it, but it just made it that not as many cows got sick. And so one of the things they've found in the US is that the cow's rumination will drop significantly. And there's a bit of time before when that drops and when they see the clinical mastitis. And so I think this is something that probably needs a bit more work and a bit more thinking out. But if you have a rumination collars on your herd, you have the potential to identify these cases before they become clinical. And so I think this is something just to think about for the future. One of those things that we can work on going forward is, how does it actually look? Do you actually know? Can you do that on your farm? Work out which cows have got a drop in production, a drop in rumination, and then can you actually separate them in a timely manner? And then the other thing, obviously, is, as well as quarantining animals, if you purchase them or move them between farms, it's also, I think, really important to reduce the spread if it does arrive on farm, and that's that spread between cows, and that's either via your hands, so your hands at milking time, or through aerosols. So then breathing in contaminated air. And I think, I have to say, until I started reading up about H5 bird flu in cows, I hadn't really thought a lot about the aerosols and how many aerosols are generated in the dairy. So I think it's probably something, just go back and have a think and have a look at your dairy and say, from an aerosol point of view, what's going on? So you want the cleanest air possible. So if you say, tip over your test bucket and the milk's on the ground, and then you blast it with high pressure hose, that's going to generate way more aerosols than if you use a low pressure hose to wash it down the drain. So specifically, what you want to reduce the amount of aerosolized milk in the air, and also even just think about like what kind of hosing down or aerosols are being formed when the cows are still in the dairy. So there will be cows in America that have been infected by breathing it in, breathing in that air. And I guess you really want to reduce that kind of spread as well. And I guess also just think about like when you're stripping cows or stripping out mastitis cows, just think about the aerosols that are generated in that process. So if you strip them down onto the platform, you get a lot more pressure, a lot more aerosols, versus if you say strip them into a strip cup where there's just not as much aerosol generation. And then the other thing is just thinking about the hygiene of intramammary treatments. So that includes the gloves, the boxes, the tubes, and just look at it from that perspective of what is the potential exposure to all those tubes and hands and gloves and all that kind of stuff in the dairy, because I think that like in terms of in your dairy, what things actually go up cows' teats, that's those intramammary tubes or teat seal tubes, dry cow, anything like that. And you really don't want, in the event of H5 arriving in Australia, you really don't want that milk going up cows' teats. And so there's that one. And then the last thing I was just going to touch on was infections in dairy staff. So in America, like from what we can, from what's published, about 7 to 10% of dairy farm workers have had, well, in the studies that they did, had antibodies to the virus. So they'd been infected. Some of them thought, yes, I had some signs of infection. So they include conjunctivitis and fever and muscle pain and a headache and maybe a cough and a sore throat. Other people think they didn't have an infection. And they were how they thought they could have been exposed. Like obviously there were people who were working in the dairy and so they're exposed to urine splash, milk splash, hosing down the dairy, handling cows, transporting milk. One thing I think it's again really important to think about is that there will be virus in the urine of cows. So I mean obviously milkers are exposed to that. There'll be virus on the platform, but most of that virus is going to be in the milk from those infected cows. And how that milk kind of interacts with your workers, I suppose, is what would be the thing that would increase their risk the most, or how much that's aerosolized into the dairy environment. Next slide. Sorry, here I'm driving the slides and even I'm getting it wrong today. So I guess in terms of protecting dairy staff, again, you never know when you're at the start of an outbreak. So I think it's important to set up some key protective behaviours that will help protect in the future. And I would say it's also like most of these actually protect against other diseases as well. So it's not like if you can get all these all in place, even if we don't have a bird flu outbreak, you're still protecting your staff against other diseases. Some key things is not drinking unpasteurised milk and minimising aerosols, like we mentioned in the previous slide. In terms of the PPE, so protective personal equipment, so this is what the CDC in America recommends at the moment, and because this is what they're recommending with this active outbreak. And if you have a look, it's the full PPE, it's gloves, it's disposable apron or overalls, it's masks, it's goggles. And I think we could probably all agree that with our experience with COVID, we know that this would be a difficult thing to ask people to do now or ever. Like we know what Aussies are like. But I think there are some key protective stuff that we should be doing now, regardless of whether we have bird flu. Key ones is wearing gloves while milking and while handling sick animals, or even while handling milk. Like if you're moving the test buckets or you're moving calf milk or whatever, wearing gloves. And then also washing hands afterwards. So after you've taken off your gloves, wash your hands. Wash your hands before you eat and drink. So basically anything you can do to protect your face, your eyes and your mouth and your nose from your hands that are potentially infected. And then also, I guess, appropriate management of farm clothes. So there's a case study, Brendan mentioned that cats are particularly prone to getting really sick and dying from bird flu. A lot of them is because they drink the milk that's got the virus in it. But there was a case of a pet cat who, when her owner, who worked at a dairy farmer, got home, she would always like roll and rub on his overalls, which had calf milk on them. And then she ended up dying. The standoffish cat, who didn't like him very much and didn't roll, didn't smooch up to him, she didn't get infected. So, the potential contamination of your farm clothes is something to think about. Again, if you have your your waterproofs at the dairy and they stay at the dairy and then you wear your clothes back home, just thinking about how you manage your clothes so that they're not going off site, I suppose, or not anything that's potentially contaminated isn't going off farm. The other thing is setting in place annual workplace flu vaccines. Obviously, I mean, I work for two organisations who both offer flu vaccines. So I get to pick and choose who I get my free flu vaccine from each year. But, not only does flu vaccination protect you against the seasonal flu, but one of the concerns about flus is that they can kind of make genetic material if there's two strains infecting people at the same time, or two strains infecting animals at the same time. So what we really don't want is the remote possibility of someone being infected with both a human flu and H5 bird flu at the same time, and then having a bit of a genetic shift. Vaccination protects against this thing from potentially happening. And then I guess the other one is, I think all of us know those people who they'll just come to work, whether they're on death's door, it's really hard to tell them to go and have a sick day. But I think it is really important to have people stay home when they're sick. One, because that stops other people from getting sick, but more importantly, to seek medical help if they need it. So one of the concerns about H5 bird flu is that historically it has a high mortality rate in people, and antiviral treatments, which have, I guess, new in the last however many years, they do improve survival rates in H5 bird flus overseas. So really encouraging, your colleagues or employees to go get help, and if they then need antivirals, they can get it. So just setting up those practices early, so if they do happen to get it in the advent of an outbreak, they're at least going to be healthier at the end. And I guess obviously this is all us, thinking about what might happen if there is an actual bird flu outbreak in Australia and dairy cattle are impacted. Obviously, the health authorities are going to review and update advice as appropriate. And I think that's it for me, Andy.
Brilliant. Thank you very much. So you've done an amazing job of taking what is a big chunk of scientific information in the report and distilling it into practical on-farm recommendations that we can actually use. I know that 12 months ago, if we had been asked the question, what do we do to prevent spread or protect our workers on a dairy farm if we have bird flu, we probably would have shrugged our shoulders and said, have a biosecurity plan, put out a few scarecrows and cross your fingers, because we didn't have this information. But now you can see there's some really simple things that we can do on farm to prevent incursion and spread and protect our staff if the worst was to happen. So, that's a great outcome from this study. So we only have a few minutes left, apologies, but we will use that to address some questions. We've got a few in the chat. So I'm going to hand over to Sally Taylor, who has been monitoring the chat and will run the Q&A. Maybe we can stick around for a minute or two past 12:30 just to get a couple in if everyone's happy with that.
Thanks, Andy.
There you go. You're
right. Zoe, I might stay on you for a moment. There's quite a few questions that have come through about symptoms. For example, is a rise in temperature an early sign that can be used as a preclinical symptom? And what else can farmers be looking out for?
Yeah, so I mean the key signs of the clinical infection or the clinical mastitis is there's a fever, there's a drop in rumination and a drop in intake. But I guess the thing is they're really non-specific. They could be any disease, but they're the things that are the early indicators, and it kind of depends in terms of how long in between those like how that in between how long cows when they're first infected and then when you see disease, it varies from about 3 to 10 days. Experimentally, it's, when you give them a large amount, you see those things within 1 or 2 days, and kind of everything happens all at once. And when it's a longer incubation period, I think those symptoms are a bit kind of more gradual, so it might be harder to actually pick up. But that's why I think they're looking at the rumination collars and how well they can pick up a drop in rumination and how useful that could be is some work we should do going forward.
Okay. And Brant, probably one for you. What should people do if animals are starting to show symptoms?
Yeah, thanks, Sally. And Zoe's sort of touched on this. I guess the thing is, as has Brendan, is if you're not for us, if in doubt, reach out, right? So there's nothing that hurts to call the emergency animal disease hotline is a really good one. I'd put it in your phone because you'll go away, you'll think about it in 2 weeks. Oh, bloody hell, what was that number? 1-800-675-888. Bang it in your phone. And if you ever need to, you can call it. It will hook into the state and territory vets and DVs or district vets, and they can provide some sort of advice and they'll work it through. It doesn't mean that if you call the number, you're going to have people with white suits and everything's going to be quarantined. It doesn't work that way. It's more about giving some advice because it could just be, as Zoe said, they're sort of nondescript clinical signs, and it might just be a normal case of mastitis or whatever. But what we'd rather have people do is if you had some concurrent events around, some mortality events in some ducks nearby or unusual cases of mastitis, we'd rather you ring and call and work it up and have it not be the case, as in not be a bird flu outbreak, than if it was. And if it is, the quicker you get onto it, the better we can manage it. So I would just be alert for those things. The biosecurity measures are really key. So the sorts of tips that Zoe's mentioned are really important, as I said, not just for endemic diseases, but for any exotic diseases. And genuinely, if you're not sure, call. There's lots of information on our website, birdflu.gov.au, on websites as well from the state and territory governments. So ring, get yourself into it early, and then we can go from there.
Great, thank you. And Brendan, I think this one would go to you. What's the pathway in the US for culled cows in an infected herd? Are they going to abattoirs or are they not allowed into the food chain?
So they've done some good studies for the meat industry over there that show that meat is safe from culled cows. So I'm not exactly sure of the practices that occur in the abattoirs, but they can enter the food chain and there's very little risk. So I guess let's take that one on notice and we can get back to with one of the facts about that. But yeah, it's not dangerous. There's no danger in the meat. Yeah.
Okay, great. Probably back to you, Brant. Sorry, I'm jumping all over the place, but would my herd be quarantined or movement restrictions implemented if we had H5 bird flu, and how long for?
Yeah, it's a really good question, and that's part of the work that the response strategy group's working up. So in the normal sort of course of events, if there was a bird flu outbreak in, say, a poultry setting, and it was in sort of, that sort of situation, then there might be some quarantine requirements put on them. That wouldn't necessarily mean that we'd go to a national standstill type approach like FMD. It's not the same sort of approach. It would, and we also saw in the States is that, and we would have to determine what it would look like here. So every sort of situation would be sort of unique in and of itself. So if there was an outbreak in wild birds, if it didn't get into the dairy herds, then that wouldn't be the case. If there was in those situations, we'd have to assess that pretty carefully at the time. So what we don't want to do is overreact and just kind of, shut down the whole system only to find that we didn't need to. But on the flip side, we know this is a new sort of way of spread, and we want to make sure that we could get on top of that quickly to manage those issues. So we will be providing that back through, but there's no kind of national requirement around standstills, quarantine per se. It would depend on the circumstances of the outbreak, the species affected, and those sorts of things. But it is a really good question.
And if there was an outbreak in dairy cattle in Australia, who'd pay for the response, and what would the compensation look like?
So currently H5 is categorized, so bird flu is categorized under category 2 of our what's called our emergency animal disease response agreement. So that's sort of a cost shared agreement, and that would mean that 80% of costs are borne by the government and 20% are borne by signatories to the EADRA or EADRA. So that's an agreed mechanism, and but interestingly, we haven't tested that because that was mostly around bird flu, and we were mostly thinking about that in relation to poultry. So, however, if it's about the disease itself, and as they are signatories, that's the current arrangement we would have in place, and that's what we would put in. If that was to happen, say tomorrow, that's the way we would go about it.
Okay, great. I know we're over time, but I might just keep going for a few more moments. There's lots of important questions coming through. Another one for you, Brant, sorry. Is there a vaccine for H5 bird flu? If not, are they developing one?
Yeah, so there are commercial avian influenza vaccines for poultry, and we know that they've been used overseas. There aren't any currently available for cattle or other mammals, but they are doing some trials in the US of vaccines for cattle. And that's something that we are really carefully looking at because that may be an option going forward. We are also looking at the sort of quite specific use of what's currently available. There's some inactivated vaccines that are registered for use in birds. And so we're looking at whether we can use that for particular threatened species in captive populations. We've been doing some trials to test that in Australia, but that's quite specific. And we're also looking at some of the policy settings around how you would use these vaccines for the poultry sector, because that's another whole question around our disease status and trade implications and costs and the like. So once before it was just we weren't doing it. Now it's a really live issue. So we're looking actively at it. And then as and when we get information, we'll be providing that out through to industry and others.
Great, thank you. Quite a few along these lines, Zoe. When using a robotic dairy, is the automated disinfection of milking cups sufficient to kill the virus?
That is a great question, Sally. So I think on surfaces, I think disinfectants work quite well against bird flu. I will have to double check what's actually been used in the robotic dairies and just double check it before I say anything. Well, I think one of the things we are looking at though is what about actual milk? Because I think Brendan or Brant mentioned that over in the States the recommendation is to pasteurize any waste milk. Because they have a lot more on-farm pasteurisation for their calf milk, so it's more possible over there, whereas obviously in Australia we don't have that as much. So we're investigating what are the best disinfectants to actually disinfect whole milk. But on surfaces there are effective disinfectants. I will just have to double check even if they could write in the chat what is the disinfectant and what strength it is that they use for their robotic dairies. And then I at least have the figure to work on, and I can get back to them on that one.
Okay, great. I think that we've got so many questions coming through, so I think I might call it there, and we will send around a wrap up with answers to everyone's questions in the next few days. So yeah, thanks, Andy.
Great. Well, thanks. Oh, sorry. Thank you, everyone, for coming along today. I see we've still got 150 people on the call, so obviously engaged and interested in the discussion. We'd love to stay and chat for another half an hour or so, but I'm sure we've all got other things to do. But yeah, big thanks to our speakers and for all of you for attending. As Sally said, we'll have an FAQ sheet that we'll distribute later. This webinar recording will be distributed along with the report, link to the report and that sort of stuff as well. So any follow-up questions, yeah, feel free to get in touch with the team. Yeah, and I think that's all we've got. So thank you.